Good morning, all. Thank you for joining us or joining me to participate in the Healthy Schools Act School Health Profile Informational webinar. My name is Grace Friedberger, and I manage the data collection for this project. Today's webinar will last probably somewhere between 15 and 20 minutes. If you have questions, please pose them in the question box, and I will answer them at the end of the webinar. So today we're going to talk about what the Healthy Schools Act School Health Profile is, how to get started with the profile online, what is contained in the profile, what's in the content, how to complete the profile via the QuickBase application, the next steps and resources that you might need, and then at the end we will go over your questions. So the Healthy Schools Act School Health Profile is required as a part of the Healthy Schools Act of 2010. This is a District of Columbia law that was adopted by City Council and the Mayor in 2010. And the implementation of that law resides mostly within the Office of the State Superintendent of Education, or OSSE. As a part of the Healthy Schools Act, it's required that schools complete every year a school health profile that documents the school health environment. So your school completing this fulfills your compliance with the HSA, and then the data is used for our purposes for reporting to City Council and the Mayor. It helps the Healthy Schools Act team inform their technical assistance. It ensures helps with our monitoring and evaluation of the Healthy Schools Act programs that we do, our grants, and where schools are at in terms of having a healthy school environment that supports student learning. The school health profile is available publicly. So your school profile is available on the OSSE website, and yours for the 2014-2015 school year will go online in the spring once more of them become available. And anybody can request the all schools data that comes through the school health profile. So if you would like to make a data request to receive an Excel spreadsheet of either the DCPS schools or the charter schools or all schools for their responses from last year or previous years of the school health profile, you can do so by going to the OSSE data request website that is listed on this screen. So getting started with the school health profile. So in November and last week's principals and the 2013-2014 school health profile contact were emailed with access to QuickBase to respond to the school health profile. However, we understand that many data managers or other vice principals, health and physical education teachers respond. So if your principal has designated you as the person that will be going into QuickBase to respond to the school health profile and you do not have access, please call or email the number and email address on the screen with your name, your title, and your school. If you are going to be completing the school health profile for each school within your entire LEA, please indicate that in your communication. So once you've logged into QuickBase, which I'll do in just a second, once you've logged into QuickBase, we recommend that you download the HSA printable form. Because the school health profile is quite long, you might need to go to multiple people within your school to gather all the information you need. And this just helps so that way you can get all the information in print in front of you and then put it online. So I'm going to just show you how to log into QuickBase and where to find that printable form. So you go to https://octo.quickbase.com. and then you'll log in. And for DC government employees, it will be your email address and your email address password. And if you're from a charter school, it's either your charter school email address and charter school your password for that email address. But if it's not, please just click forgot my password and an email will be sent to you so that you can reset your password. If you have never received any access and you receive a roadblock when you're trying to log in, it says it doesn't recognize your username, please email aussie.callcenter@dc.gov with your name and your school, and access will be granted to you. So once you're in QuickBase, you'll click on the application 2014-2015 Aussie HSA School Health Profile. And you can see right here on the main page here we have some tips for completing. So we recommend that you please read these submission tips and go through these before you start answering the school health profile. And then that printable form is just right here. It's just a PDF and it should download right here. So it's right here at the bottom of the screen. And so we recommend that you open that and print that out and take a look at the content. So that brings us to our next step. So the content within the school health profile is quite elaborate. So there's 10 sections. In section 1, your school profile, the school profile section. In this section, we ask for a contact. This person is the person that will be emailed a PDF version of your profile. So it can either be the person who fills it out, the principal, whoever you want us to contact and email the profile, and also who we'll go to if there are questions. We do conduct some quality assurance in the data just to make sure, for example, if you're putting in your minutes for lunch, that it doesn't say, 500 minutes for lunch, something like that would be a little outside the normal range, and we would just email you to verify that your data is correct. So there's the school profile section, health services section, which talks about school nurse coverage. Section 3 is about your health education instruction. Section 4, physical education. Section 5 is your nutrition program, so that's things like breakfast and lunch. Section 6 is your local wellness policy section, so there's probably either yourself or someone else at your school who is responsible for updating and implementing your local wellness policy. They would probably be the person you want to go to help fill out this section. Section 7 is distributing information, so we ask for where certain information such as your menu, your school lunch menu, your local wellness policy, where this information is available within your school. Section 8 is about school gardens, so if you have a school garden, there are additional questions that we ask. Some of these questions used to be asked separately. We've decided to combine these surveys this year just for completion and minimizing the number of surveys that we ask schools to complete. Section 9 is on environmental literacy. We have questions in there about your science curriculum. And then Section 10 is just posting and form availability, where this form will be made available and how your school, any other ways your school is implementing the school, the Healthy Schools Act. So if you were able to download the school health profile, I just want to pull up some key questions for you. So in the school health profile, question number 24 asks for you to report on the average PE minutes in each grade. So this question should be completed such that you're reporting on the average number of minutes over the entire year. I'm sorry, this is for health education minutes. Sorry. So question 24 is about the health education minutes per week over the course of the year. So this means that if you have students that are only receiving health education for half the year, say they're receiving 60 minutes of health education every week but only for one semester, that means that the students in that grade, you would report that as 30 minutes over the entire year. So please be sure to average that out. And then the same is for question 33, which is the one about PE minutes. So it's the same question. It's just asking how many PE minutes do your students receive. It's broken out by grade. How many PE minutes do your students receive each week over the course of the year. So again, if they're only receiving PE for a semester or a quarter, divide that out to make sure it's even across the school year. One thing that we want to make note of is that physical education minutes and regular physical activity such as recess time or before school or after school are different. For question 33, it's very important that you only report on the number of minutes that students are in a structured physical education class that is scheduled within the school day. This is only for the physical education class. Now, if students have other time for physical activity, we'll ask about that later. So I just want to make sure that it's only for your formal physical education class. And then within that class, question 34 asks how many minutes students are being active in the class. So sometimes in physical education, those students will be learning about how their body moves or muscles or things like that. So we want to take out as much as possible, take out that time, and then question 34, report on the number of minutes that students are actually active within that structured physical education course. And again, you really should, we recommend that you speak to your health and physical education teacher because we understand that very often health and PE are taught at the same time. So please talk to them about how they separate out their course such that you're reporting on health education minutes in question 24, physical education minutes in 33, and then the average minutes of activity within question 34. And I do want to just stress for you to please answer honestly. No OSCE police will come after you. It really just helps us gauge how we're doing and how we can support schools and what further support we can provide. So I'm going to jump back to the internet browser to show how to complete the school health profile. So here I am on the main Healthy Schools Act School Health Profile page. So I'm going to click to complete. And when you do that, for me, every school shows up, but for you, it would just be, if you're achievement prep, it would be only your school or only your LEA, whatever you have access to. So I'm going to jump down to a test school. So when you get to your school, you're going to want to click this pencil icon that says Edit. And you're going to go through and complete as much as completely as possible your first page. Anything with a red asterisk is required. And your questions here where it says grades served, we need you to complete this first because questions later on are dependent upon your answer to those questions because we do have grade level specific questions about curriculum, about the minutes of health education, physical education, etc. So you're going to scroll through. Once you get to the end of page 1, if it's completed on page 1, you want to make sure that you click this box. So you want to see this checkbox when it's complete, and then you want to click Go to page 2. And now when you get on page 2, it's going to be, you're not going to be able to write anything. You see I'm having difficulty typing in, and that's because it's on view mode. And unfortunately, it's just a glitch with the computer program. We've tried to change it, and it's a limitation of it. So you just want to click Edit. and it'll change the format such that you'll be able to change your responses and respond to page 2. So you'll go through page 2. When it's completed, again, you want to click this box, make sure that check mark is there, and then you want to click go to page 3, click save, and then again on page 3, just make sure you click that edit button at the top right corner and go through, press save. I haven't completed this page, but you'll go through, click save, and then click the completed button at the bottom. You will not receive an end email or anything. It'll just say when it's completed, you'll have these 3 stars at the bottom. If you're unsure if it's not completed, please just email aussie.callcenter@dc.gov and they'll let you know. But once you see those 3 stars, it's completed. You can also jump back to the home page and you'll see if you're completed, you'll see 3 dots. So if you see those 3 dots, that means that I can see that you have completed your school health profile. If you want to go through and answer some questions and not others and not have it completed, just make sure you click that green save button on the top right and only click the completed button at the bottom when you're absolutely done, and that's the signal to me that you're done with your profile and we can transfer it over. I can verify your data and then transfer it over to PDF. So that's how you complete the profile. Again, as I mentioned, you'll receive a PDF of the profile approximately 30 days from when you've submitted it. If you have any additional questions, I encourage you to look at our website. There are instructions on there that are written out, as well as there's a PDF on there of, with visual instructions that sort of have screenshots of what I just went through on the website, so you can see that. On the printable form that we downloaded, there's FAQ at the back. So here's the school health profile form that we downloaded. If you go to the very end, there's some FAQs here, so that might help you out a little bit. So I encourage you to use these resources to help you out with the school health profile, but we have been doing this for a few years now, so hopefully most of you are familiar with the process. If you again need to request access or you're unsure if you have access to the application, you can call the phone number on the screen or send an email, and our customer service staff will be glad to assist you. So that's all I have for today. I'll leave this instructions page and phone and email up here for just a little bit longer if you want to write it down, but I will email a copy of this PowerPoint to the attendees. There's a recording of this webinar from the November webinar available on our website as well if you want to take a look at that, to just go back and take a look. With that, I'm just going to stay here. If you have any other questions, please feel free to type them into the question box and I'll answer them. If not, thank you so much for your time and have a great day, and thank you so much for taking the time to complete your school health profile. Thank you. So I just received a question about what is the deadline. That is a great question that I glossed over. The school health profile is due on February 17th by 5 p.m. Okay, I received another question about someone requested login credentials to update their school's profile, and you have not heard back from anybody. I'll type my email address. Let me see. if the person who did that, if you can put in your comment your phone number, I'll write it down and I'll call you at the end of the webinar and make sure that we have, we can get you your login credentials. Okay, so I see, okay. Okay, I see someone requested from Excel Academy, requested your copy. I will, Ms. Purnell, if you can type in your contact, or I have your contact information from this webinar, so I will email that to you at the end of this webinar. Okay, are there any other questions? Okay, no questions have come through, but I'm going to stay on for just a little bit longer in case you're typing something out and it hasn't come through yet. Okay, it appears that there are, oh, I see another question just came through. Thank you, Ms. Conway. I have your contact information and I will add you as a user for Mary McLeod. Okay, are there any other lingering questions? Okay, Ms. Moore-Gauze, I have your contact information. I will add you as well as a user. Okay, I'm going to conclude the webinar at this point. Thank you so much for taking time out of your day, and I hope everybody has a wonderful week. Thank you.